Hello, my name's Carly Dennison. I'm going to do a presentation on prison nursing. I would actually like to start off by saying I'm currently working in the prison system as an RN, and it's definitely a unique situation with the training that I've been given and actually going to a facility of this nature. A lot of individuals do not understand what kind of nursing actually takes place within a prison. So I'll try to explain some of this now. So prison nursing, so the primary activities of a nurse within the prison system is basically the same as an RN within a hospital setting or even in certain doctor's offices, things of that nature. We are still required to be able to assess a patient from head to toe, be able to recognize any kind of change in status, obviously, if the patient has a current disease, if there is any other diseases that may come along with that, changes in respiratory and your cardiac, any of the above. For example, so we have a patient that's upstairs admitted because we actually have a hospital on the second floor. They are there for a long period of time. There still has to be certain steps that are taken to prevent them to acquire new diseases, new onset of ailments that they did not have originally. So with that being said, it takes a strong nurse to do the full assessment and the full care of that patient at all times. So there's one difference with our type of care within the prison system. So basically the security staff takes precedence over nursing staff. This is one concept of nursing care that I'm not used to, and it's very hard to adapt because we are there for the care of the patient, and even though they are prisoners, they are still human beings. So sometimes there's a slight conflict when that certain situations arise. So it also, we may need security to get to a patient, locked behind locked doors, things of that nature. So it tends to create a delay in care. All right, so another thing to be discussed as well is that empathy. So we, as nurses, tend to, because we care for our patients, we want to show empathy. So if we have a dying patient, normally in a hospital setting, or it could be a family member, it could be somebody you've never met before, a new patient. But it is natural instinct for us to want to be there for that patient and comfort them throughout the process of dying. We cannot do that here in the prison system. You can't touch them, you can't hold their hand, you can't do any of those things. So it creates that animosity, not animosity, but that feeling of like you're not really doing your job 100%. But that they see it as, in the security world, is that if you are showing too much empathy for a patient, that is a concern that they start watching you, and it creates a very difficult nursing environment. So teaching and learning strategies. The inmates themselves are very unaware and uneducated on their illnesses, diseases, their health care, and overall. And a lot of that is due to the physicians in the outside hospitals and within the prison system not being honest and being thorough with their education to the patients. Because there are a lot of patients that want to know their condition and make the appropriate decisions for their health care, because they ultimately do have an ultimate say in how they are treated within the prison system as far as their health. So it is up to the nurses and the staff to make sure that they are aware of their conditions and their status and how they can do to prevent further injury and enable them to get better faster. So, lack of education and diagnosis of interventions of their current situation can create where they get hepatitis, HIV, TB, because they do not understand how to protect themselves from those certain things. And there's a lot of that runs rapid in prison system, unfortunately. So we want to educate our patients. We want to be truthful with our patients, and at the same time, we have to make sure that we are not overindulgent in how we treat our patients with kindness, unfortunately. This could be also helped by doing written and verbal. Sometimes patients, just like anyone else, if you're in school or anything like that people learn and remember things differently. So if we verbalize the instruction, the things to be aware of, and also have it in writing so they can refer back to if they forget. Because some people are medicated prior, to being discharged, and they may or may not remember the discussion taking place between the doctor or the nurse. Let's see. And if at all needed, if that inmate needs to come back and get retaught, the discharge instructions or guidance on how they should care for themselves, and that's appropriate. Okay. Educational preparation. So to be a nurse, an RN, you have to have a current license, obviously. You do not have to have your bachelor's in nursing, but you do have to have your CPR, ALS, BLS, and your CPR situation there. So also you're going to have CNAs, LPNs also working side by side with the RNs along with the physicians. You have to be pretty fluent in your IV therapy, administration of IVs, fluids, medications of that nature, and the maintenance of flushing lines, whether it be Foley's or just IVs, PICC lines, midlines, and peripheral IV care. And then we also have just the main thing is to have the barrier, make sure you keep the areas clean. That's huge for infection spread, just like anywhere else, hospital or any other facility for that matter. So we have disciplines. So all aspects of care revolve around security staff. This is, like I was already explaining, that it's very difficult to perform your job and do it to the best of your ability without worrying about if you're too empathetic for a patient. And that's sad, because I feel like it hinders what kind of person you really are and how you want to be an advocate for that patient. And I know that a lot of inmates feel like they are less of a human in the system, and that's unfortunate. And I know that individuals make mistakes, but they are still humans. So it's a very difficult situation for medical staff to have to deal with security on some occasions. We also have, along with the RN staff, the medical staff, we have oncology, we have dialysis, x-ray, CAT scan. We do have those specialties. We have an outpatient surgical unit on the compound. There's so many things, different areas and aspects of the prison system that many people don't understand because they're not in the system. I had no idea until I actually took part. So very interesting there. And I imagine that the reason for that is to be able to keep the inmates in one location and not have to do the transportation. So we have the necessary skills and abilities. One thing to keep in mind in this type of situation, which is the same in some hospitals and other areas, you're going to be on your feet for a very long period of time. It is a very busy facility. We are the only medical service for the prison system within the state of Florida. So if you can imagine the amount of influx of inmates that we have come in and out on a daily basis. So the reality of it is that you are going to be busy. There is not going to be a slow night. There is a lot of sick patients in the prison system, and up in the unit itself, you have bedridden patients. There's inmates that actually come into the system healthy, and some make it out, some do not, and they may acquire diseases or other things before they actually get their end of service or end of sentence. So you want to make sure that you have a complete total body assessment on these inmates so that you can help them get to that point of end of sentence and leave the facility in the shape that they somewhat came in. So once again, competent IV access and holistic care and just your overall efficient working abilities is important. So some interesting information about the prison system. We're still on a paper system, so everything is handwritten documentation. We do not have an online system like some of the hospitals do, where you go in, everything's time-stamped and then put into the computer. This creates a slight issue only because people aren't really held accountable for time. You can pretty much fabricate or manipulate any documentation if it's still handwritten. So that could be a problem for the management of patient care. So one way to fix that is to get away from paper charting altogether and make people have them held accountable for their actions and for their actual overall care of the patient. And if there is issues or delay, then we can address that then. Okay, so now we have, so your personal experience. So basically, if you need to have education and a clear understanding of the different types of diseases within the system, because there's so many inmates so close together, and many inmates do not like to shower, to clean, in fear of things that could happen to them in the prison. And so like you have shingles, you have scabies, you have tuberculosis, you have other things of that nature that they do not shield themselves to further infect other people. So it can be a widespread situation in the prison. It makes it very difficult to try to confine that illness to one small area. So you also have many self-harm patients, psych patients. The psych ratio in the prison is extremely high. And then you also have the individuals who want to manipulate the system and aren't exactly experiencing a psych emergency, who take up the space, the nursing staff, and the time of the security officers to avoid certain situations that they're dealing with. So there's a lot of illegal drug use. Contraband is what they call it, that winds up into the prison system. We got K2 is the biggest hard hitter right now. That respiratory depression. Some of them do bath salts, which it amazes me the things that end up in the prison. But we have to be ready and be able to spot those things so that we can treat them appropriately. Here I showed just a few pictures just for an idea. So you're behind an enclosed structure fence-wise, and you have many people that are in wheelchairs being pushed by other inmates. So you're not just dealing with one inmate, you're dealing with multiple people, and you always have to be on guard, which brings another aspect to nursing care. You don't normally have to do that quite as intensely in a normal facility. So, and then I have my references. And a lot of this is personal experience as well. And like I said, prison nursing is not for everyone. And it has been definitely a unique experience for me. But I do know that they can definitely have some improvements for patient care. And I'm definitely willing to assist them in that and vouch for the patients and for our staff. Because it's not easy for us to do our job the most efficient without, the proper equipment, the timeliness of the inmates getting to the facility from, security. So we face a lot of different challenges than you would in a normal hospital or ER setting of that. So thank you for your time. Again, my name is Carly Dennison. I hope you enjoyed my presentation.